Well, tonight here on ABC2, we are talking about breast cancer and your breast health. And joining us now in the studio is Dr. Man Farhar, breast surgeon and director of the Breast Center at MedStar Union Memorial Hospital. Doctor, thank you so much for joining us.
Oh, you're welcome.
Breast Cancer Awareness Month, we're talking about different types of treatments and therapies. What is intraoperative radiation therapy?
Kelly, that's when we deliver radiation to the tumor bed after a lumpectomy. Remember that patients could have a choice between lumpectomy, which is partial mastectomy, versus a whole mastectomy. Patients who have a lumpectomy need radiation to reduce recurrence. With intraoperative radiation, the radiation is delivered at the time of the surgery while the patient is asleep. So by the time she wakes up, she has completed her surgical treatment plus radiation in almost all cases.
Now, so how does it compare to traditional radiation therapy?
Traditional radiation therapy is when you deliver whole breast radiation, you radiate the whole breast, and that's a process that takes 5 to 6 weeks. So there's a significant convenience for the patient. In addition to that, patients avoid radiation to the heart or the normal tissues that don't need radiation or
more
the
targeted.
lungs. It'll be more targeted where the recurrences happen, which are usually at the site of the tumor itself.
So, Dr. Farhar, is everyone, obviously this sounds much more appealing if you have to have, is everyone a candidate? Who's a candidate for this?
It's very important to select the right patients. You have to have patients with relatively small tumors which are localized and who don't have extensive disease, extensive DCIS, or involved lymph nodes. So the process of working up the patients preoperatively and figuring out who are the right patients for this technique is very important.
Benefits, I would think maybe just not affecting the whole body, just the targeted area?
Well, yeah, you avoid radiation to the lungs and heart. The radiation to the heart could be detrimental for patients. Significant convenience. There's a sense also of completeness. You finish your surgery, you finish your radiation, if you're the right candidate for it. It has a very positive effect on the patients when they can do that.
Okay, all right. Dr. Farhar is going to be in the studio next door with us taking your calls as we team up with the MedStar Health Cancer Network. The number to call is right there on your screen. It is 410-481-2222. We've got the phone lines open until 6 o'clock, so give us a call and get your questions answered. Thank you, Doctor. Christian?